Today, I am going to hopefully answer some of the most commonly asked dental questions that we hear a lot, either when patients call in on the phone or when they're sitting in the chair here at the office. Well, I really believe, and I've been doing this for over 20 years, is every 4 to 6 months actually. I know insurance can say every 6 months, but when I see patients, sometimes after 6 months, they actually have a lot of tartar buildup and their gums get really inflamed and getting the cleaning done is really painful. I feel those patients should come in every 4 months for a cleaning. They don't need to have the exam or x-rays at that time, just a good cleaning to stay on track. And also at least every 6 months for a cleaning for those that can keep up their oral hygiene in between the appointments, because it's really important to see, we look at your gums, your cheeks, everything inside your tongue, the back of your throat, for signs of oral cancer or any medical conditions can be found. I had a patient that I found oral cancer on, and it was just a teeny small little spot along the side of her tongue. She didn't even know she had it. Sent her to get it biopsied, and it turned out to be squamous carcinoma, and luckily it was caught in time and could be treated. But that's something that's very important, that the reason why it's important to come in at least twice a year, every 6 months for a cleaning. Another question we hear a lot is, my tooth is broken, do I need to come in and get it looked at? Or my tooth is broken and will I need a filling or will I need a crown? Well, it's so hard to tell that over the phone. We can't see what your tooth looks like. And trust me, we had patients try to take pictures and send them to us. We need to really take a look. We need to take a look at the x-ray and we need to take a look in your mouth. What might feel with your tongue is a little small amount, and even though it doesn't hurt, it's probably something big. 90% of the patients that come in with a cracked tooth, a whole corner of their tooth is broken off, and it doesn't hurt because most of the time it doesn't break off into the nerve, into the pain supply of your tooth, so it won't hurt. But that being said, a substantial amount of your tooth is gone and you're gonna need a crown for that. The small amount of patients that do have a cracked tooth, it hurts them bad and they know it, and that's unfortunately at that point has to be taken out. Well, actually the best thing now they're finding is to do an alternate of Motrin and Tylenol. Motrin, ibuprofen, the generic, and Tylenol, acetaminophen is the generic. If you alternate Motrin and Tylenol every 3-4 hours as directed, they work on different pain pathways in your body. And acetaminophen is metabolized in your liver and Motrin is metabolized by your kidneys. It's been found to be very effective if you can alternate Motrin, Tylenol every other dose until you can come in to see us, and that's really quite successful, hopefully, in managing your pain until you can come in. Well, dental implants are becoming more and more common, and the technology has gotten so advanced and better for the patient with these. They're great. They're the best thing. If you're missing a tooth, the best thing you can do is an implant. One implant replaces one tooth. So the implant is basically a metal post that goes into your jaw. And I like to use an analogy of like, when you put up a fence in your backyard, the fence post has to set up in the cement around that post before you can put up the whole fence. If you try to put up the fence on the fence post before that cement has set up, the fence is just going to collapse. So the implant is first placed into your bone, and the bone has to heal around it. Sometimes a bone graft is needed, but it's soft, so it takes 6 months or so for the bone to fully heal around that before we can actually put a tooth on top of that. So once the bone is all healed and everything, we put in the top part of the implant, and then the crown goes right on top. So there's actually 3 parts to the implant, but they are very, very well tolerated by the patient. They're strong. It feels like you have your own tooth back again. You don't have to drill down the teeth next to the implant to make a bridge or anything like that. You're just working on the one tooth where the space is. It's very, very good. What kind of patients are the best candidates for implants? Anyone that's healthy, really. The only medical conditions that would contraindicate getting an implant are, if you're a smoker, that's not good. Your blood vessels aren't healthy, your healing's not gonna be healthy. Long term, your gums won't be healthy if you're a smoker. That's one thing you should not be doing. You should be a smoker if you're gonna get implants. Having diabetes, another thing that makes healing slow, and healing around an implant wouldn't be good. So smoking and diabetes, you should probably get those under control or rethink that option if you're thinking about implants. Do implants last forever? Well, they last a lot longer than a bridge, and I don't ever say anything lasts forever in the oral condition. Many things can happen. You could get diabetes down the road or such and such. They do need to be maintained. You need to come in every 6 months to have them looked at. Sometimes they need to have a little bit of tightening. You could still build up tartar on an implant. You need to have the implants clean. So it's really important too just to check your bite every 6 months, because we want to make sure you're not biting too heavy on the implant. We can't put a lot of force on the implant. The force has to be even around all your teeth in your mouth. And that's something we need to check at your appointments when you come in. A bite guard is good to have, and occlusal guard to wear over your mouth at night, because every time you swallow, your teeth come together, and that's hitting. Your teeth are hitting together, and we don't want to be putting too much pressure on the implant itself. Now we use the most advanced technology, the best technology I feel, Bruxier all zirconia crowns. They're actually 3 times stronger than porcelain. They can hold up in a patient that clenches and grinds their teeth, and they won't chip. They actually look very nice too. So we have an in-office machine from Glidewell that makes our crowns out of this porcelain block, and it comes to, when it's done, how beautiful this is. Nice, look at all the little nice detailing in that. Looks just like your tooth, it's great. Done in like 20 minutes to 40 minutes. So very nice for the patient, they're very strong, and they look great too. Can they be whitened? No, they can't be whitened, unfortunately. So if you're thinking you want to have whiter teeth before you commit to having a crown that will be on for a while, hopefully at least 7 years, you're going to want to whiten your teeth first, because crowns cannot get whitened. Can these crowns be made in the same day? Yes, that is our goal, to make these in the same day. They can be made in 20 to 40 minutes. It's amazing. You don't have to wear a temporary. We have digital scans, an iTero scanner that there's no messy impressions to take for your crown impression, and while you're waiting, you can have some water, be on your phone. If you want to run an errand, come back, it's great. Will you get a cavity around a crown? You can still get a cavity on the tooth that has the crown on it. You won't get a cavity on the porcelain crown, that's impossible, but a lot of people think like, well, I got the crown on the tooth, how come I have a cavity years down the road? Because this crown covers a spot on your tooth, but the tooth is still there underneath it. And it's so important to still be flossing, brushing, coming in for your checkups, taking the x-rays to making sure all the area around the crown is still staying healthy and you're not getting any signs of a cavity starting or anything like that. So good oral hygiene at home, watching sugary drinks, and flossing is so important on your part. So many questions about root canals. Does it hurt? Most of the time it doesn't hurt. When patients come in, they often have a little bit of tenderness around the area, or they notice pain to biting, keeping them up, pain that keeps them up at night, not really any major swelling. And that's the best case for us to be able to treat a patient when they present with symptoms like that. The numbing medicine works so well. You are not knowing you're getting a root canal versus getting a filling done. I've had patients that say, oh, I've heard about root canals and I'd rather give birth than have a root canal. It's not like that anymore. Like I said, our numbing medicine works so well that you'll be just as comfortable as getting a filling done, and it's a pretty straightforward procedure. You will still have your root when the root canal is done. A lot of people think well, I had a root canal, my root is gone. No, it's not gone. It's just the center of the root where the nerves and blood vessels are in. We take that out and clean it out and fill it with a little material down in there, but your root is still there. And then the crown goes on after. The crown is very important to have on the tooth after you've invested in a root canal, because the tooth gets real brittle once the nerves and blood vessels are out. The crown is on there to help protect the tooth. Is it better to do a root canal or have your tooth pulled? You always want to try and save your tooth. The best implant is your own natural tooth. If there's not enough tooth left above the root, then we need to pull it and we would do an implant. but definitely if there's enough tooth above the root and you can save your tooth, that's the best thing you can do.